You see a title like this, and it sounds like something straight out of a sci-fi movie, right? But what you're about to hear is a completely true story. It's about a man, his best friend, and a revolutionary approach to medicine that it might just change everything.
So, our story kicks off with the 4 words that every single pet owner on the planet dreads hearing. This is Rosie, a Staffy Shar-Pei mix, and she was diagnosed with a really aggressive form of cancer. Even after chemo, even after surgery, that tumor, it just wasn't shrinking. The prognosis was grim. The vet said she had just months left to live.
And this is where the story takes an unbelievable turn. I mean, what do? Most of us, and you can't blame us, would start that heartbreaking process of saying goodbye. But Rosie's owner, Paul Cunningham, he's not most people. See, Paul's a data engineer, and instead of giving up hope, he did something else. He opened his laptop.
Now, get this. Paul has 0 medical background, no biology degree, nothing. But he decided he was going to build his own research team from scratch, a team powered completely by artificial intelligence. He wasn't trying to re-diagnose Rosie. He already knew what was wrong. No, he was going to use AI to brainstorm and innovate right at the very edge of modern science. So where do you even start? Well, if you're going to fight an enemy, you have to understand it first, right? Paul knew he needed a crystal clear picture of the cancer's genetic code, so he paid $3,000 to have scientists sequence the DNA from Rosie's tumor. This gave him the raw data, the enemy's instruction manual, that he needed to launch his digital attack.
So how did he do it? It's actually genius how he broke down this huge problem. He used a kind of 3-layered AI approach. First, he used ChatGPT as his research planner. It helped him sift through millions of scientific papers to come up with a strategy. Then, second, he wrote his own custom algorithms to scan Rosie's healthy DNA and compare it to her tumor's DNA, looking for those tiny little mutations, the typos that cause the cancer. And finally, he used AlphaFold, that incredible AI from DeepMind, to figure out the 3D shape of the messed up proteins those typos were creating.
And what was he looking for with all this high-tech firepower? He was hunting for something called neoantigens. The easiest way to think of them is like little unique flags or molecular fingerprints that only pop up on cancer cells. They're basically the signals that scream to the immune system, hey, this cell is a fake. It doesn't belong here. Finding those? That was the key to his entire plan. So Paul takes all his findings back to the university scientists, and they were just stunned, blown away. I mean, this quote says it all. Here's a data engineer, a motivated guy with a laptop, who used these AI tools to do the kind of complex work that would normally take an entire team of highly specialized scientists. It's just incredible.
But here's the thing. Having the data, having the perfect digital blueprint for a cure, that's only half the battle. Now Paul faced an even bigger mountain to climb. How do you turn all of that computer code and analysis into a real physical treatment that you can actually give to Rosie? His first idea hit a brick wall, and hard. His research pointed to an existing drug that might actually work, but when he reached out to the pharmaceutical company that made it, they refused to supply it for what's called compassionate use. You can just imagine how devastating that must have felt. But Paul wasn't ready to give up.
So he pivoted. He totally changed his strategy and focused on a technology that, well, we've all become pretty familiar with lately, mRNA vaccines. The idea is exactly the same as the COVID vaccines. It doesn't put a virus in your body. It just gives your immune system a temporary recipe, teaching it how to recognize a very specific enemy. In this case, the enemy was those unique neoantigen fingerprints on Rosie's cancer cells.
And the whole thing was just this desperate race against the clock. Paul sent his analysis over to the experts, and in just 2 months, they created a custom nanoparticle vaccine made just for Rosie. But then came the biggest hurdle of all: bureaucracy, ethics. You can't just inject an experimental drug into a living thing. Paul then spent the next 3 months working 2 hours every single night to write a 100-page ethics document to get the treatment approved.
Finally, after all that research, the dead ends, the setbacks, and mountains of paperwork, the moment of truth had finally arrived. It was time to find out if this wild idea, this incredible fusion of one man's determination and powerful AI, was actually going to work. In December of 2025, Rosie got her very first dose of the vaccine. This was it, the culmination of everything Paul had been fighting for.
In the results, well, Paul's word for it was magical. Within just a few weeks, that tennis ball-sized tumor on her leg didn't just stop growing, it started to melt away. This chart gives you a pretty clear picture of just how dramatic the effect was.
A 75% reduction. The vaccine worked.
It had successfully taught Rosie's own immune system how to find and destroy her cancer, an outcome that just a few months before would have seemed totally impossible. And it wasn't just about the tumor shrinking. Rosie, the dog herself, came back to life. Her energy came back, her coat got glossy again, and then came the ultimate sign that she was back to her old self. She jumped a fence at the park to chase a rabbit, something she hadn't been able to do for months. Paul hadn't just bought her more time, he'd bought her high-quality, rabbit-chasing time.
So what does this incredible story mean for the rest of us? Because this is about so much more than just one lucky dog. This could be the dawn of what's being called citizen science, where everyday motivated people can start contributing to solving some of the world's biggest, most complex problems.
What we're really looking at here is a massive shift in how we even think about medicine. For decades, the model has been one-size-fits-all treatments. This story is pointing to a future of truly personalized medicine, where treatment can be designed specifically for your DNA.
And I think this is the most important takeaway. The AI didn't cure the cancer by itself. It didn't replace the brilliant scientists at the university. What it did was act as a bridge, a powerful bridge that connected one man's love for his dog with the incredible scientific expertise that was needed to save her life. And this quote, this just sums it all up perfectly. For centuries, advanced science has been hidden behind these really high walls of specialized knowledge, only accessible to a very small group of people. AI doesn't tear those walls down. But what it can do is give any one of us, if we're motivated enough, a ladder tall enough to look over them and start to participate. This whole story started with one man trying to save his dog, and it ended up showing us a glimpse of a possible future for all of us. So it leaves us with a pretty powerful and inspiring question to think about. If you had a ladder that tall, a tool that powerful, what problem would you try to solve?